Yes, of course. Well, thank you everybody for being here today. So Jen, actually our company right now is doing a March into May step challenge. And so we just completed our first week last week and we are in the midst of getting more steps. And we know with people as they're, starting to be a little bit more active, though when the weather is good, it's kind of going up and down right now. Maybe things start to pop up, maybe old injuries that people have had or minor injuries that people start to see. So we're happy to have you here today to kind of walk us through the preventing these, but then also how to treat them. I'm going to put in the chat box a sign-in sheet for those who wish to receive healthy lifestyle points, but I'll just turn the time over to Jen.
Do you mind to introduce yourself? Okay, can you hear me?
Yes.
Okay, great. All right, so hello everyone. I'm super excited to be here. My name is Jennifer Gutierrez, and I'm a physical therapist here at St. Mark's Hospital. I work mostly in outpatient physical therapy, but also do a little bit of inpatient work. And I get to work with a really amazing team of physical and occupational and speech therapists. I'm going to scroll down here. So I'm talking to you today about this topic, and I'm excited that you're doing your step challenge, so I'm hoping you can learn some things. But I'm talking to you about this topic because, first of all, I'm a physical therapist. And so as a physical therapist, I've been working with athletes and non-athletes, people who are young and people who are not so young, but all of them who are recovering from sprains and strains and breaks and surgeries and chronic pain. I've also been a running coach and an aquatics program coordinator. I've been a ranger at a high adventure backpacking base, and I'm certified as a level 2 coach through US Masters Swimming. I've got 3 teenage sons who are pretty involved in sports, and so I've been involved also with their activities, including soccer and baseball, swimming, backpacking, track and cross country, basketball, and martial arts. So there have been plenty of times in my life when I've been really active, and there have also been times in my life where I've been pretty sedentary. In fact, 14 years ago, I began a Couch to 5K program, so maybe similar to your step challenge here, where I went from being pretty sedentary and a hater of running, and decided that I was going to learn how to run a 5K. And crazy, I started to love running, and then went on to gradually add distance, and so then completed half marathons and full marathons and ultra marathons, including qualifying for the Boston Marathon, and then 6 days later running the Big Sur Marathon, which is kind of a fun challenge. I've also completed 2 half Ironman races and 3 full Ironman races, a century and a double century bike ride, some long distance open water swims, and some multi-day backpacking trips. Now, I tell you all of these things not to impress you, but rather to let you know that I have had my own injuries. I've had my own sprains and strains, and I've had my own pain. I've also had to deal with my own lack of motivation at times, my own fatigue, pain, limited time, insufficient funds for the right gear, and also my own fear about doing new things, something different, something challenging. So I kind of know where you might be at. I've read a lot of books, and I've listened to podcasts, and I've learned from coaches, and I've also been a patient myself. I've taken a lot of courses, and so I've learned a lot about proper training and injury prevention. And through all of this, through helping others and through also helping myself, I've learned a lot. So I hope today to be able to share with you some of the things that I've learned through this. There are a lot of different directions that I could have gone with this presentation. I'm going to briefly touch on a few things and give you some opportunities to write down some questions. I might not get to them right at the point that you have them, but hopefully at the end I'll be able to get to all of them. But I want you to keep in mind as I'm doing this presentation too, that each of these little topics could really be an entire presentation in and of itself. So I am going to be kind of just touching on a few things. but I still hope to give you a few general principles to help you be healthier. I want to decrease your fear about pain. Instead, I want to encourage activity. And I want to help you improve the quality of that activity that you're doing so that your enjoyment will be more and that you'll have less risk of injury. All right. So my main goal today is that whether you're involved in a sport or not, whether you are sedentary or not, or whether you're injured or not, that you will learn something that's meaningful and helpful to you and maybe to the other people that are in your life. So the goals and objectives for today are that you'll understand the benefits of sport and activity, that you will have a general idea of the types of injuries that there are and whether pain means there's actually tissue damage. I want you to know how to best treat those injuries so that you can have optimal recovery. And I want you to have an awareness of when and how you can be able to return to your sport participation and competition. And lastly, I want you to know how to prevent injury, including if you're in pain currently, should you continue exercising? All right, so we know that because physical activity is increasingly becoming more organized, right? More people are doing organized sport, that this role in society has become increasingly important over the years. But this has been kind of an interesting year, right? Because of the pandemic, many of our organized sports and training programs, our gyms and recreation centers, they've been closed, and racing and sporting events have been canceled. So think about, how has this affected you and your family? We're seeing a lot of changes and a lot of things related to this here in our therapy department. So what have you noticed about your own activity level, your own motivation, your own mental health, your own physical health, and your connection with others as a result of some of these changes? You can see some of the headlines here just from the last year regarding how COVID-19 pandemic has affected activity levels. All right, so we know that being active, even to a small or modest level, is superior to being inactive or sedentary. And unless you've been living under a rock, you probably know some of these things already, but just because I want to be thorough and also maybe just continue to motivate you to be active, I wanted to share with you some of the benefits of physical activity or exercise. So we know that increased physical activity helps us maintain a healthy body weight by reducing body fat. We know that it helps to stabilize blood pressure and cholesterol levels and decreases cardiovascular disease such as stroke and heart disease. We know that physical activity improves our immune function. We know that it improves our intestinal function. We know that it lowers the risk of type 2 diabetes and helps to stabilize our blood sugars. It reduces the risk of certain types of cancers. It increases flexibility and improves joint mobility. It improves coordination, movement, balance. All of these things then help to reduce risk of falling and being injured. Exercise strengthens our bones and our muscles and our joints, thus lowering the risks of developing osteoporosis or other joint problems such as arthritis. We know that exercise aids in rehab after surgery, illness, or injury, especially when there have been long periods of bed rest. We know that physical activity helps to decrease chronic pain. It helps to prevent and manage mental health conditions such as depression, and it lowers stress and anxiety. So it improves one's state of mind. It can boost your mood, your energy levels, and your concentration and your confidence. It also is neuroprotective, so it can help to decrease cognitive decline, which includes dementia. And it can give you an opportunity to meet people and to have fun. Okay, so are you motivated now to be more active? I wanted you to keep these things in mind now as we talk about some of the risks of activity. All right, so that we know that activity is beneficial, right? We also know that with participation in sports and physical activity, there is a risk of injury. So as you and your family return to or continue to participate in sports, or as you start to work towards your goal of being more active or taking more steps, what steps can you take to prevent injury? I feel like this is the most important part of this talk, is the prevention of injury. I don't have time today to talk about every single sport individually, but these 10 suggestions can really be generally applied to just about any activity that you're going to be participating in, and really at any level that you're at. But don't get overwhelmed by them. Don't look at this list of 10 things and think, oh my gosh, there's just too many things. Maybe pick one or two things to start to focus on, so that you can just be more aware and be more healthy. So I'm just going to go down the list quickly, and if you have questions about any of these, we can talk about them. So the first one is, as you are exercising, you want to be aware of your own body's limitations. We're all very different, and so we might have areas in our own body that are less stable or less flexible. We might not have the balance that we need or the strength that we need to be able to do something. And so being aware of our own body limitations can be really helpful, so that we can then prevent injury, because then we can work on those things. The second thing is, we know it's important to gradually build intensity and duration. Sometimes we get really excited to get started into something and jump in full force, and we know that for preventing injury, it's important to just gradually build that intensity and gradually build that duration. The third thing is, it's important to cross-train, right? And so if this walking challenge is the only activity that you're doing right now, look at other things you can be doing that aren't weight bearing. Things like swimming and cycling and other weight training can be really helpful, so you're not just doing one particular thing all the time. The next thing for preventing injury is make sure you've got the right gear, right? So for example, make sure you've got the right shoes for the sport that you're participating in, so that you don't end up with injuries just because of that. For all levels of athletes, making sure that you're properly hydrated and that you have the proper nutrition is going to, of course, decrease your risk of injury. The next thing is make sure that you get sufficient rest. And so that means not just getting enough sleep at night, although that's super important, but also making sure that you have rest days or rest weeks where you're not continuing to just build and build and build, but you don't give your body a chance to recover. When you're doing an activity, take a look at your form. And if you need help, have somebody else take some video of you so they can help you figure out what things in your form you can work on. So look at the technique of what you're doing. Look at your posture when you're doing that activity. Think about how you're breathing during that activity. Those can have huge impacts then for preventing injury. Make sure that during your training days that you warm up and that you cool down. So you don't just jump into high intensity activity. We want to gradually then build up to that and then let your body cool down afterwards. You also want to monitor your body for signs of overtraining. So you can be aware of how much fatigue are you feeling. That can be an indicator then if there's too much fatigue that maybe you need to ramp up a little bit more slowly. Be aware of your heart rate, not only during the activity, but also your resting heart rate. Your resting heart rate first thing in the morning can be a great indicator of how you're feeling and how your body is doing with the amount of activity that you're doing. If suddenly your resting heart rate is significantly different, it might mean you need a little bit more rest, or it might mean you need to hydrate a little bit better. So it's a great idea for each of us to at least be aware of what our individual resting heart rate is, so that then we can better take a look at that. People who have smartwatches often will have that, at their disposal because their watch is monitoring that. But I think heart rate can be a really great thing to look at. If you're noticing reduced performance, and that can be just not in your sport, but also just in your day, it might mean that you need to take a little bit more rest. Or if you're noticing that just generally you're getting ill more often, or that you're having more pain, of course, then pay attention to those things and start to make some changes. And then the last thing on this list for preventing injury, which I think is actually kind of an important one, is what are you doing outside of your sport or activity? Sometimes we get this 30 minutes a day of really intense activity, and then the rest of the day we are sitting with flexed poor posture and being pretty sedentary. And so just be aware. Sometimes it's those things that are contributing to your injury even more than the activity that you're doing. So make sure you spread out some of that activity and that you're aware of your posture during other times during the day. Okay, so now after talking about the benefits of exercise and sport participation, you might be thinking, yes, but exercise and participation in sports can cause pain too. And you're right, it can. So have you ever been exercising and become aware of a little bit of soreness or irritation or maybe some sharp pain? I want you to think about, what does that pain mean to you? When you were growing up, what was your parents' response to your pain? Or maybe what was your coach's response to your pain? And then if you have kids, has your child ever come up to you and said, this hurts? What has been your response? There was a great study done in the British Medical Journal. It's printed up in the British Medical Journal about pain and fatigue in athletes. And they looked at 3 different mindsets regarding pain. And what they found with pain and fatigue, that these are reasons that a lot of times athletes will then stop exercising, right? They'll avoid or they'll reduce what they're doing. And oftentimes these sensations of pain, when they're brought up to medical staff, even to well-intentioned physical therapists, so you might say like, I'm having this pain, that then that well-intentioned health professional will say to you, stop doing what you're doing, right? Either because they're afraid that there might be some tissue damage or that there's excessive training happening. But actually, paradoxically, what they found in this study is that that management plan, so extended rest, actually then what it did to them is it made these athletes, what kept them healthy, right, was the activity. And what they found is then because of that fear, they stopped exercising and they became deconditioned. And so then there was more injury. So then on the other hand, sometimes coaches or the athletes themselves will view these sensations of pain and fatigue as weakness, right? Either physically or psychologically. And instead they'll tell the athlete, you know what, just ignore that pain. We want to toughen you up, right? Just push through it. But then sometimes this leads those athletes to have increased symptoms or more injury. So both of these opposing views between medical staff and coaches, they sometimes reflect limited understanding that we might have about the interaction of training loads and beliefs and other factors that contribute. So then what happens is then the athlete is kind of left thinking, should I tell my doctor about this? Because then I might have to stop, or should I tell my coach, or should I just remain stoic? So looking at this slide, I want you to think about, what does pain mean to you? What they found in this study is listed in the middle here. And that is that really the way we want to think about pain is that there are multiple factors happening, right? And so if we're aware of what those factors are, we can make adjustments. We can be more aware, and this will then in turn make us more resilient and help us to train smarter. All right, so I want to take a little side trip here and talk a bit about pain, because we know that the more you understand about pain, the less likely it is that your acute pain that happens will then turn into chronic or persistent pain. So I'm going to go a little bit into this. So we know that pain does not always mean there is tissue damage, right? Pain is a normal human experience, but living in pain is not normal. Your nerves in your body, they monitor different parts of your body, kind of like an alarm system. They warn you, and then they warn your brain of potential threats. If your brain senses that this is a threat, it produces pain then to tell your body to take action. Therefore, pain is a decision that's made by your brain when it perceives a threat. So you only feel pain when your brain thinks there is a threat. What your brain thinks is a threat is influenced then by your past experiences, by your beliefs, by your emotions, and by your current circumstances. So pain is actually really complicated. It's not just about injury. Sometimes your brain produces pain even though your body tissues are healthy and safe. There are two different types of pain. There's acute pain and there's persistent or chronic pain. Acute pain usually begins suddenly, right? Because there's been an injury. But this pain goes away once those tissues have healed. And healing usually doesn't take longer than 3 to 6 months. And we'll talk about this a little bit more. Acute pain, though, is necessary for survival. It alerts us that something is wrong and needs our attention. So it's actually a positive thing. Persistent pain, however, is pain that lasts beyond the time needed for healing. So then in that case, the pain is no longer helpful to us. So in persistent pain, the nerves, which again are your body's alarm system, they become really extra sensitive. And when this happens, it only takes a little bit of movement or activity, or even just a change in emotion to kind of set off that sensitive alarm system. And your body isn't really in danger. It's just that your nerves have changed the way that they respond to normal sensations. So it makes you more hypersensitive to pain. The good news is, though, that you can calm your nervous system down by gradually forming new habits and thought patterns, by managing your stress, and by gradually increasing your activity level. This can refocus your attention kind of away from the pain and ultimately train your brain to dial down that pain. So pain neuroscience could be a whole separate presentation. It is actually really interesting, but the main point that I want to make today is, like in the study I was telling you about, pain has multiple factors. I want you to be able to see the sensation of pain as you're starting into an exercise program as helpful and not scary. Pain is your body's way to tell you to make adjustments. It's the way that your body then can help you increase your awareness to good changes that you should be making, including seeking help from a professional, which might be a physical therapist like myself, earlier, so that you can then train smarter. All right, so then what do I tell my own patients, some of the athletes that I've coached, or my own kids about pain? I like to use this stoplight, and there's kind of a lot on this slide, and you might not be able to read it all because it's kind of small. So I will go through each of the things on here. So first, let's start down at the bottom with green. Green, of course, means go, or carry on. So this would be pain that you're having during an exercise, right? So you start your walking program and you notice a little bit of pain then when you're walking. But then when you stop walking, the pain stops too, right? So this is just the first warning sign from your body that something might be wrong. So this is the point where you want to just be aware of what might be some of the possible causes and start to make some of those small adjustments, but continue exercising, right? When we move up now to yellow, yellow we know means be cautious. So this is when you are exercising and there's pain during the exercise. And then this pain kind of continues after you exercise, even up to 48 hours after you've stopped the exercise. So this is the time when you want to start self-managing, right? So you want to identify and modify some of those reasons that you might be getting an injury. Cross-training is a great thing to do at this point so that you continue to stay active, but maybe decrease the load on the tissues. Perform some corrective specific exercises so that you can strengthen up some of your weak spots and actively work towards regaining your normal function. But the red, I want to make sure then that there are some times when you need to actually stop doing your exercise. And these might include when you have pain that is sudden, like when there's trauma, right? You've fallen down or something, then and you've got the pain, then you want to be a little bit more careful and maybe stop. If that pain is really sharp and it doesn't ease up and it starts to limit your ability to do your normal daily activities, right? This might be the time to just hold for a little bit. Also, if you have pain that lasts more than 48 hours, if you have pain with hopping or if you have an inability to weight bear on a leg, This is kind of a big red flag, right? It's a time to stop. And if you go in to see a doctor at that point, then those are also indicators that you might need an X-ray or an MRI. We don't like to overdo those diagnostic procedures, but if you're not able to weight bear on a limb, then generally we would say it's time to get in and get that checked out. If you have unusual swelling or bruising in an area, this is the time to go and seek help from a professional, right? You might seek help a little bit earlier, but this is definitely the time when it's important for you to stop what you're doing and get in and get this taken care of. One other note that I have under red here is if you need to take pain medication in order to do your exercise, that's not okay. And so if you find yourself popping pain medicine just so you can get out and do your exercise, really, we would love you to get in and see someone about that pain, because taking pain medication then changes your body's response, right? That your body's trying to tell you something so you can make some changes, and you're covering that up. So we don't love taking pain medication just so that you can participate. All right. So causes of injury. So sometimes we do everything right. We go through that whole list of 10 things to prevent injury, right? We have the right gear, we've gradually increased our distance and intensity, we're hydrating, we eat properly, and we still end up with pain that actually does indicate that there has been tissue injury, right? So injury might occur because of a traumatic event. So in this photo on the left, you can see my youngest son. And as he's going towards a soccer ball, everything looks great, but what you can't see is that moments later, both he and a couple other players end up in a pile on the ground, leaving one of the players with a concussion and another with a sprained ankle. So those would be injuries caused by trauma. And it was important, like it would be with any trauma, that we stop the play at that moment and we assess the injuries, right? So that's traumatic. Injuries, though, can also occur from overuse. And if you can see the picture on the right-hand side here, you can see my oldest son. This was when he won the championship race for our district, and it was pretty awesome and amazing. But then the next year, after a summer of running at an intensity that his body could not maintain, he ended up with a hip injury that then prevented him from even finishing his season, right? So with repetitive strain and excessive loads, sometimes our tissues can break down, leading to injury. And so these are considered overuse type injuries. Okay, I also don't have time today to go into every sport and every individual injury, but I wanted to talk just generally about what tissue might be injured that might be causing the pain that you're feeling. All right, so here are 6 different tissue types in the body that are often injured. First, number 1 is muscle. This is the contractile tissue in the body, right? You can have different grades of injury to your muscle. Some of the common ones with sports that we see are hamstring strains, groin strains or adductor muscle strains, and low back muscle strains. Tendons are the next part. The tendon is the connective tissue that goes from the muscle belly to a bone. And some common tendon injuries include IT band syndrome, patellar tendonitis, quadriceps tendon rupture, Achilles tendonitis, and rotator cuff tendonitis. You can see that a lot of these have itis in them, and itis just means inflammation. So that's kind of a warning sign to us that something is going on. Bone is the living tissue that's in all of our skeleton. Some common bone injuries include stress fractures. A lot of times these happen in the foot and in the tibia, which is the lower leg bone. Femur fractures. These are most often from trauma, where someone falls and breaks their upper leg. And bone spurs, and these can happen down in the ankle or the foot or up in the shoulder. A lot of times they're just from overuse. The next tissue type is ligament. Ligaments are the connective tissues that connect bones to other bones, and they provide us stability. Injuries, though, to ligaments might include an ACL tear. That's probably the most common one. That's in your knee. Other ligaments in the knee that can be affected might be the medial collateral ligament. That's the ligament on the inside of the knee. and the lateral collateral ligament. That's on the outside of your knee. And I would also kind of classify plantar fasciitis into this one, even though it's not a ligament, but it functions very similar to a ligament where it's connective tissue that gives us stability in the foot. Next is cartilage, and we know that's the smooth covering on the ends of bones. That's our kind of our cushion for the bones. And some common cartilage injuries include knee osteoarthritis, which is pretty common, osteochondritis, which is an inflammation of some cartilage, fissures, which are little cracks in cartilage, and chondromalacia patella, which is kind of a softening of the cartilage behind the kneecap. And then the last one is nerve. So a nerve can be injured and you might end up with numbness and tingling or some weakness as a result of that. Some common nerve injuries that we see include carpal tunnel syndrome, sciatica, and ulnar neuropathy and other neuropathies. So how do you know if one of these tissues is actually injured? Well, if there was trauma, then you would probably know right away because the body part might not be aligned correctly, or you might have a pop or a sudden force to an area. But in general, if one of these is injured, you're going to notice swelling in an area. You're going to notice redness, probably an increase in temperature in that area, so more heat surrounding that area of injury. You would notice a change in function, right? Maybe a change in strength or in range of motion in that area. You might also notice a change in sensation, like numbness or tingling. And then, of course, you might be experiencing pain. And so then you would know, something is injured. Okay, so then you're injured. What should you do? So no matter which of those different tissue types are involved, there are some common recommendations for what to do initially. And these things help to aid in recovery. You can see the three most common ones here. You're probably familiar with these. There's RICE, which includes rest, ice, compression, and elevation. And then there's been an addition to that, which then adds a P for protection. And then there's been an addition to that, which now we use the acronym POLICE, which includes optimally loading something, right? So let's talk just briefly about each of these. So often after an acute injury, a little bit of rest is actually necessary. So like if you're a runner and you might need to take 1 or 2 days off from that running, or maybe just cut back on the intensity or volume or speed in order to allow those tissues to begin the healing process, because we do want them to begin the healing process. The problem that happens, and also really the reason why we've progressed from using RICE to instead using the acronym POLICE, is that a lot of times people feel compelled to rest the injured area for a lot longer than is necessary. And this can then actually lead to decreased muscle strength and flexibility, and it can delay your return to normal function and activity, right? So it can also then contribute to pain that shifts to become chronic. So rest in this case doesn't mean strict bed rest. It just means resting that particular tissue that is injured, and finding ways to stay active while you're resting these tissues is really key. So the ICE, which stands for ice, compression, and elevation, these are helpful because, all right, we know that swelling that happens right after injury is actually helpful, right? It's the way that our body starts to heal. But sometimes too much of that swelling can cause more pain and cause compression on other structures around there. And so if that swelling is doing that, then people will often rest longer than is necessary. And so using some ice and compression and elevation in the right way can help to just manage that amount of inflammation that there is, so that it still is helpful instead of becoming more of a problem. That letter P that was in there for protect. So what this means then, protecting the area, is after those initial 1 to 2 days of kind of relative rest to the tissue, then we start gentle motion, but sometimes we have to protect that area. So that means that sometimes someone might need to use crutches or a brace so that we don't end up with compensatory things happening, right? Like weight shifting away from the injured side, and suddenly we have hip pain that we didn't have before, or suddenly we have low back pain because our body has come up with a strategy to just decrease the weight on that side. So using a crutch or using a brace, or even for some people using taping, kinesio taping, can help us to just facilitate better healing in that area. And then the OL for optimal loading. So after that rest and after that protective phase, then we really should begin to start to load those injured tissues. So this means gradually stretching and strengthening and adding weight and adding resistance to those healing areas. This progressive loading can actually help to promote optimal healing. And it can also prevent delays in returning to normal that might happen because of joint tightness or muscle weakness or even muscle atrophy. And we'll talk a little bit more about that in a minute. So some things that we've learned from research studies, though, are that prolonged rest may actually delay recovery and adversely affect the tissue repair. Also, controlled early resumption of activity can stimulate repair and restoration of function. We know from research that programs need to be very specific to the individual and also to the individual sport. And so a one-size-fits-all approach is not the best for optimal healing. So although I could give all of you an exercise sheet today of what exercises you could be doing, it may not be the best for each of you individually. All right. So then the big question we always get from patients is, okay, I've been injured. Now, when can I return to exercise? And we say, well, that depends, right? The first thing we need to consider is what phase of healing is the tissue at? We know that there are 3 main phases of healing, and they're listed here. And during each of these phases, there are important types of exercises that can be performed. So during phase 1, which is the acute or inflammatory phase, which usually lasts from day 1 to sometimes about day 7, that's when you have kind of the warmth in that area or swelling or redness and pain, right? So this is when you're in the inflammatory response. This is when your body is bringing blood and lymphatic flow to the injured tissues. This is when the body's also removing some of the damaged cells. So acute inflammation is actually a really good thing. So don't be afraid of inflammation. It can actually be really good. But our goal during this phase is to manage that inflammation, like we talked about, so that it's not so much that it's either limiting our motion or causing so much pain. So this is when we use the ice and compression, right? We can work on pain-free range of motion, so moving that area. So like in this picture, you can see the ankle injury. That was one of my many ankle injuries. So when you're inflamed still, you can still move that area, and it's actually important to move that area gently, but where it's pain-free. As we go into phase 2 of healing, this starts to happen on around day 3 and can progress all the way to about 3 weeks after an injury. This is called the regeneration or the proliferative phase. And this is when the body is bringing in cells that are really helpful. These cells start to produce new collagen. Your body's creating new blood vessels, and it's repairing the injured tissues, right? So there's a lot happening during this phase. Our goal during this phase is to start optimally loading, but this is when the loading of that area is still kind of gentle. So we continue to work towards getting range of motion in that joint, and we can even begin to do some strengthening. Usually during this phase, we do strengthening that is concentric, which means a shortening contraction of a muscle. It's a little bit easier on that healing area. But important during this phase is if pain is persisting, then we need to modify the intensity of those exercises. And then the third phase is the tissue remodeling phase, right? So the body has brought in this new collagen, and then during this phase, we need to gradually load those tissues so that those tissues then heal better and they heal stronger. And so our treatment during this phase focuses on continued stretching to make sure that we're not losing flexibility, and eccentric strengthening. So eccentric contractions are ones that are lengthening contractions or loading contractions. It still is important, though, with all of these three phases to make sure that we get through all of these three phases, right? So that our tissue has healed fully so that we can prevent risk of re-injury. Okay, so to answer that question then, when can I return to exercise? Well, you can return to exercise right away. We just need to let the tissues heal, right? But we do it in an active way. And during each phase, we continue to be active and exercise, but we might not be able to continue to go back to the same level of training that we're at in competition just yet. Okay, so when we provide recommendations for returning to training for sport, however, we need to look at what tissue was affected because different tissues take different amounts of time to fully heal. So does that mean that then during this whole healing time, we completely rest? I hope by now that you know that I'm going to say absolutely not, right? So remember what we said about beginning to optimally load the tissues on those first couple days or after those first couple days, right? And by the way, this is my middle son. I wanted to make sure he had a picture in this presentation too, since I had my other two boys in there. His main sport is swimming, and he's had less injuries than the other boys. So let's see, let's talk about tissue healing times and ways to improve the healing of these tissues. So first, muscles. Muscle, of course, it depends on the degree of injury, but generally muscles take about 2 to 4 weeks to heal. They have a really good blood supply, which is why they're the fastest to recover of all of the tissues. But the way that we can help them to recover is to move them, right? Because contracting and stretching the muscles by specific exercises actually stimulates the blood flow to that healing muscle. So that encourages health and healing. Next, we have the tendons again, and these take a little bit longer. They take 4 to 6 weeks to heal. And that's because they have a more limited blood supply than the muscle itself. So we know also, though, that with that, getting more blood to that tendon is really important. So we want to exercise that area and start to load that tendon. And this helps with that tendon remodeling. Remember the remodeling phase? And so we actually do want to apply some tension to that area, making sure that it's not excessive tension because the tissues are still healing. The next tissue is bone. Bone takes a little bit longer. It takes 6 to 8 weeks to heal. And guess what? Just like tendons and muscles, the bone heals best when load is applied. So it's actually important for us to start to do some weight-bearing activities through the injured bone because this stimulates an increase in bone growth at the injury site and then a subsequent increase in bone strength. We still sometimes need to protect that part for recovery, so that's why we might use a boot or a brace. This still allows some weight bearing, but it protects the healing bone. So even if you're allowed to weight bear on a healing bone, sometimes we still need to immobilize that bone. So this might mean we need to put you in a cast, or someone might need to have surgery with internal plates and screws and rods so that the healing process can occur. Because if we allow too much movement at a fracture site too early, it can lead to delays in that fracture repair. So our rehab with bones then often focuses on normalizing the body movement in the regions kind of around the fracture site, which promotes circulation and strength. Ligaments are next. Ligaments take about 10 to 12 weeks to heal. We know that they have a much more limited blood supply than muscles or tendons, and so that's why they're longer to heal. It's important with ligaments that, depending on the grade of the sprain of that ligament or the injury, that we still protect that site. And so oftentimes with a ligament injury, it's necessary to have a brace. And so you might have seen this in someone who's had a surgery for an ACL tear, where they have to be in a brace for a certain amount of time, and where we really need to make sure that that area heals all the way before we start to do certain activities. Cartilage is the next area, and cartilage takes a lot longer. It takes 12 weeks to heal. It's avascular, so that means it has no blood supply, and that's why it's so slow to heal. The way that cartilage heals, however, though, is by movement, because nutrition for our cartilage is maintained by the fluid that's around the cartilage. This lubricates the tissue and makes it healthy. So this occurs when there is load applied and then when that load is removed, like cycling and walking, right? Cartilage is aneural, so that means there's no nerve supply to it. So if you're feeling pain when you've had a cartilage injury, it generally means that the cartilage has been worn down enough that other tissues start to be giving you pain, right? So the most important thing though with cartilage is that inactivity, so not moving, actually has the most negative effects on your joint cartilage. So a lot of times people will say to us, oh, I have arthritis. I can't exercise because of my arthritis. But what we know about cartilage and how it remains healthy and then also how we help it to heal when there's been injury there is we need to load it and we need to move that area. So again, movement is helpful. And the last one is nerves, and nerves take a lot longer. They heal at about 3 to 4 millimeters per day. So we have to be patient and we need to progress our program pretty carefully. So what's the big picture here? Tissues do heal, right? They heal at different rates and they heal best with movement. It's also important to note here that sometimes surgery is important and is needed in cases of complete ruptures to muscles, tendons, and ligaments, or unstable fractures. But it's also important to note that research really does support prehab. So that means if you need to have a surgery, going and having a couple sessions of therapy before the surgery can actually really help you heal from the surgery a lot faster. And then of course, rehab after that surgery helps with healing. Okay, so then lastly, you've gotten back into exercise and you've gotten back to training, and then athletes will say, okay, when can I actually return to my sport? And we take that usually to mean, when can I play in a game, or when can I compete in an upcoming race or an event? So we know that athletes first need to be rehabbed for participation in that exercise, and then specifically for their sport, and then lastly for competition or for performance. Right, so if you've been out because of an injury, and even when that injury has healed itself, and so there's no longer inflammation and there's no longer pain, a lot of times athletes will think, great, I'm ready to go, and I'm going to jump right back into what I need to do. But what we need to consider is a lot of times in that healing process, cardiovascular endurance and muscular power, agility, and balance haven't been worked on as much. So making sure that we're doing some of those sport-specific training things is really important too. And of course, this is a plug for physical therapy since that's what I do. But research has also shown that the number of rehab or training sessions that an athlete completes prior to returning to their competition directly relates to re-injury rates, right? Well, I guess inversely, right? So the more sessions of therapy that you have, the less likely you are to have a re-injury of that tissue. And so they even found that athletes who completed less than 4 training sessions prior to their match day had a 3 times higher injury risk than those who completed 4 or more training sessions. And then with each additional session after that 4, the injury risk continued to lower, with a 13% reduction in injury for each additional session. So that's kind of significant and important for us to consider. And some of the other factors that you can see on here outlined, and this is from the START tool, which a lot of us as clinicians and coaches and trainers use to determine if someone is ready to return to their sport. It looks at risks and risk tolerance. So if we, and there's kind of a lot on this slide too, but I'll kind of quickly go down. First, we have to look at the health risk, right? So we need to look at the specific athlete. We need to look at their age. We need to look at how severe their symptoms were, right? Because if they're more severe, they're going to take more time to recover. We need to look at other medical history things that might be affecting them. And then was there a previous injury? If someone has chronically been injuring their ankle, they're going to need a little bit more time to get back to the sport than someone who this is their first injury to the ankle. And then when we look at activity risk, that's specifically looking at the sport or what activity it is, which is going to be different depending on the type of sport. If you're in an impact sport versus a non-impact sport, there will be a difference in how much time we need to spend rehabbing. Also, what position is played? What's your limb dominance? If you're right-handed and it was your right hand that was injured, then there might need to be a little bit more time before you can return to your sport. Of course, the competitive level of the athlete whether you're an elite athlete versus just an amateur just getting started. There will be a different amount of time that needs to be taken. You need to look at, is there protective gear that's going to be used? And of course, the psychological readiness of the athlete. If the athlete is still afraid of re-injury, they're going to perform differently. And so we might need to address some of those things. And last, we need to consider some of the risk tolerance that's associated with the timing in the season. Is it early in your season, or is it right before your big race that this injury has happened? How much pressure is on that athlete to return, whether from themselves or from their coach or from their parents? And then, of course, are they masking the injury with medication, which then might increase their risk, right? So the big picture here is there are a lot of factors that play into your success in returning to your sport and prevention of re-injury. So you might not consider yourself an elite athlete, but still paying attention to some of these things can help you to prevent re-injury as well. All right, so quickly to sum things up. If you're injured, remember these key elements of recovery. First is timing. Early intervention is best. So don't feel like you need to ignore the injury and just keep pushing through. Get it taken care of right away. Remember that your activity needs to be active, that the exercises should be specific for you and your own body. Remember that it's important to retrain your brain so that these injuries don't become chronic, and don't let fear of pain stop you from being active. And last, make sure that your recovery is complete. So fix not just the injury itself, but also the reason that it happened in the first place. Although the tissues will still heal in a certain amount of time, like we talked about, optimal function and decreased further injury, of course, can be achieved with the help of a physical therapist. So what I hope you understand from all of this is that being consistently active is associated with less pain and less injury, right? Increased activity is good for you. It makes all of your tissues healthier. It makes your body healthier. And increased physical activity doesn't necessarily mean just sport. So as things return to normal this year after our Zoom meetings and virtual learning and WebEx presentations like this and social distancing, I want you to think about what goals you have in the area of exercise and sports. If some of these goals include starting a new sport or training for a new event, or just returning to some of the things that you enjoy, I hope that you're going to be able to use some of what I've talked about today to decrease your risk of injury and to decrease your fear about pain, so that you can better take care of your body, and if you need it, ask for help from a health professional. Okay, so now comes questions. We have a few minutes for questions. That's where...
Thank you, Jen. Our first question listed was how to get over a fear of falling. This person said, I have always been clumsy, but as I get older, I don't bounce back the way I have in the past.
I think that's such a great question. And when we look at the research that is surrounding falls, we find that a really big indicator of falls is a fear of falling. So getting over that fear can come from starting to practice some of the things that are limiting you, right? So becoming more active, working on balance, and seeking help from someone who can really take a look at you as an individual and say, I can see that you're limited in range of motion and that might be contributing, so let's work on that. Those can be really helpful. So I think it's great, whoever wrote that question, that you're thinking about that, because like we talked about, being aware and starting to make some changes can be really helpful. There have been some great studies associated with that too that look at practicing getting up and down from the floor. So a lot of times the fear of falling comes from the fear of not being able to get up after a fall. So in a safe environment where there's someone to help you or where there are things to help you, practice getting up and down from the floor, because we find as people age, they're not doing that, and then they lose the ability to do that. And if you find you're not able to get up from the floor, go and seek help from a physical therapist.
Thank you. The next one, let's see, here it is. Can you continue exercising when you have a significant size bruise on the muscle? Not related to sports, but to physical activity of moving boxes.
Yes. So the big answer is yes. Of course, like we talked about, you might need to modify the amount of exercise that you're doing or the way that you're doing exercise. But like we talked about, all of the different tissues in our body actually need movement in order for those tissues to heal. And so continuing to be active can be actually helpful. What you want to monitor for in this case is, are there changes, right? So as you're doing your exercise, is your pain increasing, or is swelling in that area increasing, or is the bruising increasing, right? And if we think back to that stoplight that I presented, those might be then putting you in that red category, right? So when things are really increasing and there's more pain and more swelling, that might be an indication that you need to stop and probably seek some help from a professional so they can help you better load that area in a way that will still be safe.
And the next one is a hernia surgery. How long to recover before start walking and exercising?
All right, so again, it depends. Depends on where the hernia is. Um, but like we talked about, tissues heal best with movement. So movement is important. One of the most important things when you're healing from a hernia surgery is to recognize that most hernias are indicating there's an area of weakness there. And so even after surgery, that area is healing. And a lot of times the injury has occurred because of a dysfunction in the way that we breathe. And so when we hold our breaths during an activity, then that puts more pressure in these areas of weakness. And so being aware then as you're exercising, or as with the recommendations of your doctor, you start to again lift things, or you again start to move things, that you're really aware of how you're breathing. So often we as physical therapists will teach people to use a technique called exhale with effort. And so in that way you inhale to prepare, and then you exhale when there's effort. And that can mean even the effort of going from sitting to standing, or from lying down to sitting up. And that can change the amount of pressure that's in that area. And so it really is very helpful for that hernia to start to repair. But walking especially is very beneficial for recovery.
And this next question, it says, I have always heard that if you have a cold in the body anywhere above the neck, you are good to continue working out. But if it is affecting the lower parts of your body, you should not work out and wait until you feel better. What are your thoughts on this? Can you sweat out a cold?
That's a great question. And I, even when I was looking up like ways to treat injuries, and as we think about ways to treat injuries, there's a lot of controversy, and you can go online and find, all different things associated with this. We know when we look at respiratory infections, we know that movement is helpful, right? And so a cold, then movement and activity is going to be helpful, but then we might need to modify a little bit. And so if you have a cold, I think it's really important to keep active and keep moving, but to modify so it's not at the intensity. Some people talk about if there's a fever, then you don't exercise, and I tend to agree with that. I tend to say those would be those, like even with a tissue injury, right? Those are those first couple days of letting things heal. And so I think paying attention to your body and how it's responding is probably the best thing in those cases.
And this says, what about singing? Does that cause pressure while recovering from the hernia?
That is such a great question, and there's some really good research right now about singing in particular, and depending on the pitch of singing and kind of how you sing. And so being able to modulate the amount of pressure that's in an area is really important. And so as singers, a lot of times you learn how to use your diaphragm correctly. And so as you're healing from that hernia, if you can work on breathing techniques, first of all, so that you know that you're using your diaphragm and that the pressure in that area isn't too great, then apply that also to singing. That can be really helpful. I would definitely recommend, if you have questions with that, to seek help from a therapist who might even just be able to watch your patterns and kind of help you assess the amount of pressure that's in that area, either through your abdomen or above, so that you can feel confident. Because again, I want you to leave this not being fearful of pain and not being afraid to do the activities that you enjoy. And that includes, in this case, singing. And so again, you might need to modify a little bit, but it very much relates to your body and your form and what you're doing individually.
Thank you so much for answering all our questions. That's everything we have in the chat box. If anyone has any anything last minute they want to throw in there or unmute themselves. We have one more minute.
And feel free, like, thank you so much for being here. And feel free to reach out to a physical therapist. Not necessarily, it doesn't have to be me, but I think most physical therapists are quite happy to share what they know with you as you're starting to exercise, or with your team if you're exercising with a team, or with your family. Like, reach out to the people who, because there's so much more than what I talked about today. And so sometimes it might be just seeking help, just to ask a few questions and to have someone just look at you individually to be able to help you. Don't be ashamed of that. Don't feel like you can't reach out for help. We want to share what we know with you, and we hope that we can be helpful.
Well, thank you so much again. It was absolutely wonderful. I loved all of the content you had about pain. So we hope to see you soon in a workshop in the future and hope everyone has a great day.
Thank you. Bye.